Our guest today is someone I've been wanting to bring on this platform for a long time. Love, Nurse and Allied Staffing is here, and we're going to talk about something that impacts your care, your family, and the entire healthcare system, even if you never noticed the ripple effects. If you're listening and you ever sat in an ER waiting room for hours, if you have felt the strain of short staffing on a hospital floor, or if you ever wondered why the quality of care feels different, depending on where you are and who's taking care of you, this conversation is for you. By the end of this episode, you're going to understand why the nursing shortage is not just a staffing issue, but a quality and safety issue. You're going to walk away with a clearer picture of what excellent nursing care looks like. You will also feel equipped to advocate for yourself, your team, and your loved ones in a healthcare system that is becoming more strained by the minute. Love, Nursing Allied Staffing, welcome. Thank you for being here. Before we get into everything, I want you to talk directly to the person listening right now. What could shift in their life? What could actually change if they take to heart what we're about to discuss?
First, Dr. Kimberly, thank you so much for having Love Nursing Allied Staffing here today. Definitely appreciated. If we could talk to our client, not even just our client, but to the person directly, and that's a good way to put it, the person. Okay, because we kind of tend to put things into a client and patient and forget to think about the person. But if we could talk to the person directly, whether you're the patient, the loved one of a patient, whether you are the physician, the nurse, if we could talk to the person of healthcare, we would say that excellence is required. It is required in this hour. It is required in every hour, in healthcare, but definitely with the challenges that are presented within healthcare. Excellence is absolutely required.
I want to make sure everyone listening understands what's truly at stake here. This isn't just about filling positions in hospitals or clinics. It's about the quality of care that you, your loved ones, and your community receive every single day. When there aren't enough experienced nurses, patient outcomes suffer. Wait times get longer, cost goes up, and the strain on those who are working doubles. If you're a patient or caregiver listening right now and you felt frustrated with delayed care or notice inconsistent attention in a hospital or clinic, this conversation will help you understand why those challenges exist and what it takes to create better outcomes for everyone. If you're a nurse practitioner, or healthcare professional who's trying to manage staffing shortages or mentor new nurses, you're going to walk away with practical insights about how to elevate care quality, support your team, and make meaningful changes even in a strained system. And if you're a healthcare entrepreneur building staffing, recruitment, or clinical support solutions, this discussion will give you a clear lens into what excellence really looks like in a nursing operations and how to meet it while serving your community and staying sustainable. Before we jump into our story, LS, we want to get to know you a little bit more better. This is our icebreaker. This is the easy part, okay? Don't overthink it. We have 5 questions we're going to do in 5 minutes. First one, without telling us what you do, your title, or the roles that you play, tell us, who are you?
I am first a believer of God, the Most High God. First, I am a believer of love, across the board, love and charity. I am a believer in community. I'm a believer in optimal health. I am a friend. I am a partner. I am a lot of titles without a title, but yeah, in
That
a,
was good.
I think.
Yeah, that was good. I put that one in there because so much of the time we do lead with those hats that we wear, and
Yeah.
our identity can really get lost.
Yes, absolutely. And I love the way that you phrase the question without the titles,
Mhm.
because we can get wrapped up in title, um, and forget about person. So yeah, the title, it almost can diminish you in a way, to forgetting the soul source and sense of, purpose and intervention and innovation, so I can very much appreciate the icebreaker.
The next one, a lot of the guests who come on here are high achievers, talking about many hats. We want to know, how has the goalpost shifted for you in the last year?
Um, the many hats, as it relates to shifting the goalposts, I think that as an entrepreneur, especially if you're in small business, the many hats kind of never goes away. I think we kind of shift into what those hats look like, maybe different hats at this point. Um, but I think just from a not only a business perspective, but also a healthcare perspective, that while the hats are required, it does require us to shift, right? And, take off some of those hats. And so the way that we have kind of gotten to the goalpost of where we are with Love Nursing Allied Staffing and some of the things that we strive to do is making sure that we kind of delegate and shift and create opportunities that allows us to maneuver within that shifting of taking off those multiple hats and delegating those tasks within business, small business, and definitely in healthcare. We've taken the healthcare component and placed it within our business in our internship program. So some of the things that you would see within a healthcare program internship is, some of that mentoring, a seasoned nurse with a newer nurse. And we've taken some of that same model and have put it not only with our nursing standpoint, but with the clinical back office standpoint as well.
One thing you love about yourself?
Um, One thing I love about myself is we are long standing. Yeah, long standing, and long, you have to have that enduring, with the endurance. I love the endurance.
One thing you're learning about yourself?
I am learning to, trust the process, learning to trust the process.
And then lastly, if people remember one thing about you from your journey, when this is all said and done, what would it be?
Um, life's journey has its lessons and blessings, embrace it all.
Lessons and blessings, embrace it all. That
Yes.
could be the title of your book.
Here you go. It's like,
Doesn't have to be right now. And just like those interns who are helping you run the business, you can get ghostwriters or you can make them public and they can help you get the job done.
yes.
Okay, LS, before we jump into our case study today and find out what it is that you do, let's start with your story. How did you get here and what made you dedicate your career to elevating nursing excellence and shaping the healthcare workforce?
Um, I start off first as a healthcare provider, been in healthcare for 20 years now, pushing 20 years now. Started off as a receptionist in healthcare. And so I've had the opportunity to advance not just within healthcare administration, but within clinical healthcare. In clinical healthcare administration, I am a nurse myself. Come from a critical care background, but then later post COVID, we would say went into more probably 2019, we would say, went into surgical care services, and post COVID, or within COVID, kind of required surgical services and critical care to kind of um, merge and come together and do a level of strategizing because we no longer had elective surgeries. What I noticed within that was a constant need for staffing, not only as it related to nursing, but specifically as it related to specialty nursing, right? So it was a demand in a certain type of nursing. And then what we found is that while there was a fulfillment, whether it be like an agency nurse, intern, a resident, we would find that while the clinician was experienced, that sometimes the clinician was not familiar with the population, the patient population in which they serve, which is at the top of the priority, right, is the patient population. So a lot of serving the patient population is understanding, some of what you're dealing with, those cultural norms, the health norms, the health disparities that may be presented within certain communities. And so it's just being aware of that. And we wanted to present not only solutions to people that were able that or to clinicians or clientele that were having an issue with staffing, but we wanted to staff with excellence. We wanted to staff with nurses who understand the importance of cultural competence, understanding the importance of optimal health in communities, wanting to be able to learn and engage about things that are happening specifically as it really relates to Maryland. We very much, while we have a heart for healthcare in general and for the healthcare population in general, a lot of our my love specifically came for the Maryland population and what it deals with out of TCOC, which is total cost of care, and is based around quality based nursing. Right. And so Maryland has a set of initiatives that are based around quality. Right. And so that was very attractive to understand, to know that Maryland A had that initiative, and B that that we had this understanding in this drive to want to push that initiative forward without even knowing that this initiative was there. So to find that the mission of Love Nursing Allied Staffing was aligned with the mission of Maryland really blessed us. Really much.
And so, yeah, you're joining us from Maryland. While we are a global platform and we have global audience, show is a love letter to my home, the DMV. And so we absolutely love when we can bring resources like yourself to the public and let people know who's right around the corner in our neighborhood. While we're very known for politics and we think it's super important that nurses are involved in politics, we do other things there too. And some of that is providing excellence in nursing. I wanted to go home specifically to start my nursing career because I wanted that foundation to be in excellence. So you were talking about kept saying we. Are you referring to yourself when you're noticing this demand in specialty experience nursing, or were you talking about nursing as a whole at that time?
Myself and nursing as a whole, within nursing, you tend to build a lot of networks and you tend to go a lot of places and meet a lot of different people. Myself, I am from Colorado. And so I started a lot of my career there. And some of the, my friends will call down and say, well, how is nursing there? And, this is what we're dealing with in nursing here. So when I say we, it just comes from, that solidarity of nursing that we kind of tend to naturally gravitate towards one another and have.
I love that because nursing is very local, but also very global and national.
Yes.
And so when we are talking about to our clinician friends who are either setting out a new career or maybe they're getting a little burnt out where they are and they're thinking, what are my other options? We'd love to let you know that you can leverage your expertise from wherever you started and cross the state line, cross the pond. There's so many options here, and you're helping us to bring awareness to that. And so when did your company actually start? How long have you been in business?
We have been in business since November of 2020. We came into the business, and then we actually were established and able to be functional in August of 2022. And that was just secondary to a lot of the backlogging and a lot of the kind of challenges that were related to COVID. We came in at an interesting time.
And so a happy anniversary. It's November.
Yes, thank you.
And then you're in Maryland now, but during our brainstorming, you told me that you're providing services in Colorado too. So you can just tell us what's your pitch for what it is that you do and what you do and why it matters.
Absolutely. And here at Love Nursing Allied Staffing, we place nursing excellence, okay, whether that is the RN, the LPN, the CNA, and we place clinicians who are skilled with specialty and med surge and rehab ability. We do that in Maryland, Colorado, and in Virginia.
Thank you. I love that. And actually, I asked you to do that pitch. I think we're going to start incorporate that a little bit more into the show. That all you who come on can really position yourself for venture capitalists. And I love that you talked about cost. We're going to get back to that because at the time that we're recording this, it couldn't be more timely. We have the big, beautiful bill on the table. And right now, what the conversation is that nursing has been stripped of its title and is no longer considered professional when it comes to access to loans. So now graduate loans are going to be capped at $100,000. And people are saying that's going to limit the number of people who go into nursing or who can pursue advanced degrees. And it's a conversation for another day, but we don't always talk about money when it comes to nursing. However, healthcare is a huge expenditure when it comes to the gross domestic product. And every decision that we're making every day that we show up for work is costing somebody. It's costing us, it's costing our patients, and it's costing our country. And so we're going to get into costs soon, but the venture capital. So when you're talking about business, you need money. Okay, you got to have skin in the game. And a lot of times we'll complain and say, "Hey, they don't understand they don't understand the problem I'm trying to solve. They won't listen to me. They won't invite me to give me a seat at the table." I'm all about building your own table, for one.
Yes.
Number two, I know nurses have money. Okay, nurses they might have 5,000, they might have 50,000. If you're a small business, you could use either one of those checks. And if I don't have it, I can go, even though I don't always promote it, I know how to get that money really, really quickly in a really short period of time. And I think we're overlooked when it comes to capital. Not only as a funder, I can fund your business. I can give you that $5,000 check tomorrow, but also as a valuable business to invest in, right? In order to have generational wealth, you have to have something that makes money in your sleep. That's owning a business or investing in someone else's business. That could be in the stock market, or it could be Love Nurse Allied Staffing.
Yes.
Someone I actually know in my neighborhood, right? So you say you don't trust the stock market. Well, I can trust you. We just had breakfast together. Or I watched you grow your business over the last 5 years. There's trust right there. Maybe I'm mentoring you. Maybe I'm part of your advisory board, and I'm embedded in that. That's something I trust. I can touch. I can see, and I'm willing to put in $5,000 or $50,000 and know that in 3 years or 5 years that money's going to double.
Yes.
And then you just got something that you needed desperately to grow your business and achieve your mission. And so that's a background of part of the mission that I have.
Yeah.
Because the money here, the value is here. And so I had to do my little TED Talk.
No, no worries.
You just mentioned costs in Maryland. Can you go a little bit further into that?
Absolutely. Cost in Maryland. And I love the points that you made as it relates to nursing, how it is that we get to that money, right? So if you're in a business venture and we're talking about cost of a business venture in Maryland, right? From a healthcare perspective, the best thing that you can do to gain capital kind of in those first years is to be that person that wears the hat, all the hats. Sometimes that's your only option as a new business. Like you said, sometimes to work a shift, couple shit that's the only thing that's all you have to fall back on. So the main thing is, regardless of where you are in business, at least within healthcare, there's a lot of different kind of businesses out there. I can talk to healthcare business, but as it relates to healthcare business, the main thing is making sure that you are maintaining your skill set within the clinical setting. It's whether it's being educated through modules or educated at the bedside, the main thing is to be sure that you are staying educated, know what opportunities are out there for you, know where it is that you can connect to, know what resources are available within your community, know what small business opportunities are available within your community. Don't take every unanswered call personal, just be diligent. Right. And so these are again, when you're finding that you're having difficulties, one of the best things for you to do is stay involved within the political arena and say, hey, this is what I'm noticing from a small business venture. This is it, because this is how we become heard. Right. Also, when we unionize, nursing, is now feeling, especially here in Maryland, back to cost in Maryland, we are feeling, nurses especially, are feeling the ramifications of quality based reimbursement, right? And so Maryland is, and a lot of people don't recognize this, Maryland is the one state of the um, entire 50 that has its own set of healthcare laws, right? And so their reimbursements are based on um, quality of care as opposed to just what we would call an all payers model, meaning, Kimberly may have Blue Cross, LS may have Cigna. Well, an X-ray for Kimberly is going to be 300. An X-ray for LS is going to be 300. We'll bill their insurance, and whatever their insurance doesn't pay, we'll bill them. Maryland doesn't necessarily have that. It doesn't necessarily go that way here in Maryland. So it necessarily is total cost of care is the quality there. Did that person, sustain an injury? Did that person, have an event while they were obtaining, this care? And where we find that quality, where we're struggling with quality, a lot of the time it is just really related to lack of bodies, right? Like I don't think that there is a healthcare provider out there that gets into healthcare to, have patients have unwanted or, undesired events. I don't think that there's a nurse out there for that. But when we have healthcare shortages, there are some things that are just inevitable. When we don't have enough eyes, ears, bodies, to take care of the person, right? And so that reimbursement is then affected. The reimbursement may not be as much if there's an issue of quality here in Maryland. That in turn, if your company is not being reimbursed at the rate that it expects to be reimbursed, that in turn affects your annual raises. That in turn affects your raise caps, and your raise incentives. So it is very much, again, excellence, quality is being demanded, even from a reimbursement standpoint, right? It almost used to just be from a clinical standpoint, but it's even again from a reimbursement standpoint.
Thank you for breaking that down. Let's jump into our case study, and then we can find out even more about what it is that you're here to do. First, I want to welcome our guest here. If you're new here, welcome to Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co-hosts here, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand it, and then to use it to manage your health and advocate for others. We do that through two missions here. The first is to promote health literacy. The second is to elevate the expertise of nurses, which is what LS is helping us do today, to bring awareness to all the diverse career opportunities, and then to let all of our clinician friends all the ways they can leverage their expertise as both clinicians caring for patients, but also as entrepreneurs. If you haven't already, this is your chance to subscribe. Leave us a comment or two, give us a thumbs up, share this content. Every time you engage with our platform like that on LinkedIn, YouTube, social media, or any of your favorite podcast apps, it lets the algorithm know that this information is important. So that when someone like you looks for information like this, will show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you seek medical attention and medical guidance from your healthcare provider. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Now, imagine a hospital in Maryland is facing one of the longest average wait times in the country, 23 hours, and a critical shortage of experienced nurses. Patients are waiting, staff are stretched thin, and the system is at risk of delivering poor outcomes. Love Nurse Allied Staffing and our team are called in to provide solutions, not just filling shifts, but strategically matching skilled nurses with the specific units and patient populations that need them most. A particular story could follow a patient whose care was delayed due to staffing gaps, but because of proactive recruitment and preceptor placement, the hospital could improve outcomes, reduce wait times, and give the patient a better experience. What if every hospital could access nurses, not just to fill seats, but to elevate care, reduce burnout, and improve health outcomes for the community? This is what we're unpacking today, the real impact of excellence in nursing staffing and healthcare operations. So, can you describe how staffing shortages directly impact patient care and outcomes?
Absolutely. If we take just a look at some of the literature, and falls are at the top of healthcare concern. We have falls that are experienced within healthcare facilities that cause major injuries within populations. While a fall may not be a issue in the adolescent community, a fall is definitely an issue in the elderly community, right? And we have a lot of elderly homes, and what we're dealing with is definitely a aging population, and so that's guaranteed to us, right? Is aging, all of us, no matter what age or stage we are in life. Okay. And once we get to a certain point of life, we are entitled to have a level of quality of life, right? One of those being um, freedom from injury, like falls, right? This is why it's a big issue. Okay. Another thing that we tend to experience or tend to hear about are missed alarms, missed events. We can get that burnout issue. When we have nurses that have too much of a patient load, we can get that burnout issue where we become tone deaf to the alarms that are within healthcare settings. Okay. Um, or if a nurse is overwhelmed with a patient load and can't respond to the alarm secondary to patient acuity. Patient acuity is another big thing within hospitals. Is the patient load appropriate for the nurse? Is the patient ratio? That's something that we hear within the healthcare setting all the time. Is the patient ratio appropriate? Right. And so when we don't have enough adequate bodies, we run into those very, very harmful, and even we never even want to risk a patient. If we can avoid risking a patient's safety, we always want to do that. Safety should be at the top of our list, and anything that screams safety issue, we should be at the forefront of it. So again, those shortages that leads to not enough supervision that can lead to a fall, or those alarms that can be missed due to a heavy patient ratio, or those warning signs, those key warning signs that can be missed just secondary to burnout. They're all necessary things to address. The way that you address them is through adequacy of healthcare providers, adequacy of just not healthcare providers, but of skilled healthcare providers. It's one thing to have a nurse, it's another thing to have an experienced nurse. There's one thing to have a nurse who is new. There's one thing to have a nurse who is new and mentored. And so it's making sure that you, from an agency perspective, making sure that we are taking the initiative to not only place clinicians, but making sure that we place clinicians with the current and evolving needs of facilities, right? It's not just a what do you need right now? It's a, okay, what challenges are you being presented with in this moment? What are your key what are your key pain points as far as patient care is concerned? Getting down to understanding where the client is there. A client can call and tell us all day long, hey, we need some nurses. Okay, we need nurses for, do we need nurses to ensure to decrease our fall risk? Do we need nurses to mentor, the nurses who may need more training? we want to get into the more of the body. We don't want to just place a body. We want to place adequate bodies. And we want to, again, make sure that we are placing talent that is matched with the current and evolving needs of healthcare facilities.
A heart attack does not always look like the movies. It does not always come with someone clutching their chest and falling to the floor, especially not in women, and especially not in Black and brown women. Here are the signs: chest discomfort, pressure, squeezing, fullness, or pain that lasts more than a few minutes or goes away and comes back. Discomfort in the upper body, one or both arms, the back, the neck, the jaw, or the stomach. Shortness of breath with or without chest discomfort. And other signs that women more commonly experience include nausea, lightheadedness, and unusual fatigue that comes on suddenly and feels different from normal tiredness. Women are more likely than men to have a heart attack without classic chest pain, and research shows that women's symptoms are more likely to be dismissed by care teams and by themselves. Do not dismiss yours. If you think something is wrong with your heart, call 911. Do not drive yourself to the hospital. Do not wait for symptoms to pass. Aspirin may help if you are not allergic, but call 911 first. Know the signs, trust your body, act fast. This message is brought to you by the Melanin Initiative Podcast, where we simplify health information so you can advocate for yourself and the people you love. Find us on Apple and Spotify.
Thank you. And I love that you talked about adequacy. So what do you actually look for when it comes to matching nurses to assignments to ensure that you're getting that clinical excellence rather than just placing a body?
Absolutely. So one of the key elements that we pride ourselves on here is our back office, because our recruiting team, they're clinicians. Our education team, they're clinicians. Our reception team, they are clinicians. Okay. So we, from the point of contact, you are talking to a clinician. Okay. A lot of the times, what people don't understand is a recruiter may have been a recruiter for a healthcare company. They may have been a recruiter for a trucking company. Okay. So some agencies can look at recruitment as recruitment. But to have healthcare providers who are recruiting other healthcare providers are where we pride ourselves, because we're going to know whether or not you're fluffing that resume a little bit, whether or not you have that experience, and really whether or not you're a great match for the clinicians and what, the client populations in which we serve, and so you really want to have a strong team, not, a strong group of individuals that not only understand healthcare, but that understand the mission of where healthcare as a whole is going, understand the challenges. You want someone who understands, the challenges of the patient populations. And so in order to have a person that truly understands that, it is our representation that it is best to have clinicians to do that.
And so what's your biggest challenge in finding experienced nurses or preceptors right now? Because I'm in the room with a lot of entrepreneurs who are struck. So they've been consistent and persistent. Their business has grown. And I say, it's when you are consistent and persistent, your business will grow. And when that happens, you're going to need help. And one of the hardest things entrepreneurs have is just trouble, first of all, accepting that they need help. Right? Because especially even if we learn this as a nurse, it's so much quicker for me to just do it myself than to try to delegate. You talked about delegation in the beginning, than to try to delegate, wait for you to do it 3 times as long. And so we have that same mentality when we get into our business. And right now they're really struggling to get what I would call good talent. Right? Attracting someone who's going to buy into your mission, not abandon you in 6 months to start their own business, and who really understands what it means to grow the business. So how do you attract good talent, and where do you find them?
The first thing that I would say is to attract good talent. Go into your network of what you've built as a healthcare provider, just from being a healthcare provider. Again, from a nurse's standpoint, whether it's via nursing school, whether it's via, a nursing contract that you may have picked up, tap into the network that you're already familiar with. tap into your friend who may be a nurse and say, hey, would you be interested in this venture? Tap into the network that you have. That is where you should always start. And then great ideas spark other great ideas, right? Look for people that are doing what you were doing, already successful. Sit next to these individuals, have a conversation with them. How did you do that? Where did how were you able to connect? Try to be very intentional about the connections that you are making, right? Like if you are, recruiting nurses, we don't necessarily need to be talking to the tow truck man right now. Not that he's not important, but like we need to be making sure that our time is very intentional when we are dealing with networking. We have to talk to who we need to talk to when we need to talk to them. Sometimes it's not always the time to talk to the clinician. Sometimes you have to go to the tow truck driver and say, hey, do you know any nurses? Yeah, actually, my sister is a nurse. Actually, I do. So don't be afraid to make the connection with somebody who necessarily is not within the field. However, just know when and where and when it's appropriate to make those connections. And again, networking within the connections that you already have.
Yeah, it's huge on networking. There's over 5 million nurses, and each of us know at least one person. So that means there's even more people who can connect you to another nurse. And I love your use of intentionality. So when you're going to those meetings that are forced to you because you're a student, or you're going to some membership that you pay for annually to attend, yeah, they might be talking about
Yes.
high blood pressure, but you're going to go talking about you need staffing. When you
Correct.
go to that conference, yes, they're going to be talking about their latest drug, but you're not going to leave that place until you find 5 people who can connect you with the experienced clinician that you need to grow your business.
Yes.
So
Yes.
that's what she means by intentionality. I don't care why they invite you on their podcast. You're going to mention these 5 points before the show is over. That's what we mean by intentionality. And you really won't, people don't know how they can show up for you if you don't tell us that you need
Yes.
help. So let's do a little check-in with our audience. So far, we've discussed the nursing shortage, which, quite frankly, I don't think it really exists. The shortage is where you're at, but there's a plethora of nurses. It's just whether or not you know how to find them, you know how to care for them, you know how to compensate them well, and take care of them when they're there. And nurses know how to speak up for themselves. Hey, I'm not happy here. I need to be compensated better. I'm ready to move in and move up and get more professional development. Don't just abandon it. Burn those bridges that you need that you'll need again.
Mhm.
Speak up and say, this is what I need. This is my other strengths that I bring to this business. Can we sit down and talk about it? Because I'm burnt out or I'm tired. I'm thinking about moving on. So it's nurses have accountability too.
Yes.
We've talked about the impact on patient care and why staffing solutions that focus on excellence really matter. So let's get into some actionable strategies and let our audience, our first takeaway for them, which they probably know, quality matters over quantity. They tell us this all the time.
Yes.
Matching the right nurse with the right patient can improve outcomes, like falls, reduce wait times, and certainly enhance that patient satisfaction that they're going to get a call about to let us know how their stay was. So if you're a caregiver listening right now, you might be thinking, how do I know my loved one is getting care from someone who's qualified and culturally aware? LS, how would you address them?
I would say for that patient or that patient's family, we are the experts in healthcare. You are the expert on your loved one. So you sit and you have a conversation and ask for it. No question is a dumb question in healthcare. Any question that you have, ask. When you don't feel like you're getting the questions answered, remain an advocate. Ask for a patient advocate. There are some great resources. Ask to be connected. That's one thing that I am, again, grateful to, not only nursing, but healthcare in general. There are some great resources within healthcare. So if you want to know if your loved one is being adequately cared for, sit down with your immediate resource, being your nurse. Your nurse is a great advocate. That's one of his or her top priorities is advocacy. Okay. Talk with your nurse. Figure out what it is that your concerns are, what your patient's concerns are. You know, anything that you feel that you may need, reach out to your nurse. Your nurse is always able to connect you to greater resources, always.
Or we'll tell you who can, or we'll go look it up, right? We were
Absolutely.
very much about honesty. And I think people, that's a culture shock until you enter the system, because before that, you think the doctor is king, right? And our physician friends are our friends here at the show. But one of our missions is to bring, elevate the expertise of nurses to let you know that when you are going to get cared for, when someone's going to put a catheter in your arm, give you that medicine that you finally agreed to, wake you up after you've had your surgery, help you get out of bed for the first time, welcome you into your home, continue your wound care once you get discharged from rehab, that nurse is the one delivering the care.
Yes.
That's where your relationship is. And that's where your complaints can go. And they can help. I haven't seen very many nurses that will not, that have so much pride that they won't say, you know what, maybe I'm not the best person to help you right now, but I will be glad to find the best person who will, to help you navigate those questions and all the data that's out there that patients and their loved ones are exposed to every day. That can be a little bit overwhelming. But it's the nurse. People think when they have a problem that a doctor is going to be the one that's coming in and solving it. I haven't been to one healthcare setting yet where the person who's going to come in and solve your problem isn't a nurse. I'm happy. I would love to hear it. Do you?
I've not heard it, but
When we're talking about systems and systems thinking, operations, that is nursing. All the time we talked about the top of the show about your identity. And so we hear this come from mothers and wives, how they can lose their identity. We hear this from people who have big titles like cops. As soon as they retire, there's a huge suicide rate because of that identity. Right? I'm not doing the thing that I was so tied to. Who am I anymore? Right? We see this in divorced couples. We see this in clinicians. Especially as an entrepreneur, if you decide that one of those hats you're going to let go of is the one doing the work because you've hired a full team of staff and now you're going to be doing operations, you start to say, well, I'm not a nurse anymore, because our identity is really, we haven't really formed, we don't have a consensus on that, because there isn't a box you can put a nurse in, right? Even if you're in that position, you're not caring for the patient directly with your bare hands. The decisions you're making, the operations that you're running, the money and the budget that you're in control of, that is still nursing, right? From the door to the grave.
yeah.
There's a nurse involved in every step of that, right? And we spend the most time of anyone in this industry with other humans.
Yes.
That allows us to be experts in human behavior, masters of communication, problem solving. We're really problem solvers who just happen to have a clinical expertise. But if you can see yourself as a problem solver, you can literally solve any problem in any industry at any time. But we have to believe that.
Yes.
So for our nurses listening, I know you see this all the time in your practice. What should they be telling their patients, or how should they advocate for themselves while they're giving care?
When they're giving care, the first thing that I would recommend any nurse to do is always check with the inner. Check with the inner and how it is that we are showing up, how it is that we're presenting something. That I say to nurses and patients, I promise we're the only one that raises our hand to show up to healthcare facilities. Most patients don't say, oh, let me go hang out at the hospital. So they are coming to us with a
Oh, there are some.
right? There are some.
We love you.
There are some.
We love you.
There are a certain kind, no, and that there's a special nurse for that.
Yep.
There's a special nurse for that. There is absolutely a special nurse for that. And God bless the nurse who is able to deal with the population of patients who says, I want to go hang out at the hospital. I'm grateful, to what it is that they do. I really am. But for the most part, when people present to any healthcare facility, they are presenting with a major change in their health condition. And so checking with the inner is required because those patients are relying on us to, show up. And when you are feeling burnt out, you have to be honest. And again, even if it's going and say, hey, charge nurse, house soup, can I get a, reassignment? This is what I'm struggling with. But just like you said, we have to, as nursing, be okay with, hey, I need something. Okay. So like you said, being willing to express that need, because if you don't speak up, we don't know. In my experience, it has been that if you go to your clinical educator or your clinical supervisor and say, this is what I'm experiencing, because of their level of experience, because of where they've worked within their career to get to where they are, they understand. They understand. That's the beautiful thing about nurses. They are a understanding population. So we have to be mindful and just know that it's okay it's okay to not always be okay, and it's okay to recognize that you're feeling burnt out. And honestly, because of nursing, and because nursing has stood up and said we're feeling burnt out, the patient ratios there, it's a lot. Because nursing did that, healthcare communities and healthcare facilities have taken initiative to have programs for nurses that feel burnt out. So, keep raising your voices, keep being heard on what that burnout looks like. Absolutely.
Yeah, and sometimes us coming together has led to policy changes. We see that there's actual laws that have been passed because of that. And so I want to talk about something, because you talked about tapping in. So let's say our friend has tapped in, and let's talk about what they're afraid to ask. What can they do if they feel that the system feels overwhelming and that burnout has creeped in? What's the next step they should take?
Do what nursing has taught us well to do: research. Research those, not just as it relates to healthcare, but as it relates to healthcare policies. Get involved, know what those laws, regulations look like, because it's easy for us to feel burnt out. It's easy for us to have a complaint, but we're nurses. We know that complaints without intervention is very problematic. So let's recognize where we are, what our challenges are. Let's do our research. We're great at that. Nursing, we're great at that. There's a whole profession of nursing dedicated to nursing research. Okay. Find these communities, that are associated with some of the challenges and concerns that you are facing. There are a group of nurses who are challenging, very specific and very universal challenges. Connect with them all.
Yeah, we'd love for you to connect with us at Mahogany Dermatology Nursing Education and Research, or one of our alumni, Dr. Kimberly Souffrant, a PhD trained nurse practitioner who founded Souffrant Institute, all about research over there. So those are two different paths when it comes to doctoral research. And I love that you mentioned tapping into the people that you work with, right? And depending on where you work, you might have direct access to a nurse educator and a leader who's in that position for that mentorship. And what I always tell everyone, I think what we all tell everyone, is you can have more than one mentor, and you should, in and outside of your profession and outside of that job, because that mentor who's outside of the job is going to have your best interests in mind, right? So even when you move on, because you will move on, when your interests change, they go with you. And when we sign on to be your mentor, we know your path is going to change. You spend 30 minutes convincing us that you love this one thing, and we buy into it, but we know because of our own experience, like you alluded to, that it's going to evolve, and we're there to support you when that happens. And also, we don't mention it enough, coaching and mentorship. And sometimes, yes, that's paid, because look, we're talking about the cost of loans. They're not free. It wasn't free to attain that education. that stethoscope, those textbooks, those labs, it costs money to acquire them. That knowledge that you have, it didn't come for free. And so to give it out isn't going to always be free either. Now, when you join your professional membership and you pay a dues and you all get together, either virtually or in person, you have access to hundreds of people who probably do charge outside of that membership. But when the two of you sit down and eat dinner together or attend this meeting and you ask them a couple questions, they're going to answer your questions. They're going to give you their phone number, and you're going to get that free advice. So there's so many paths, and I think we don't really tell each other that enough, especially we don't tell children that enough.
Yes.
Especially people sending children to professional schools like nursing and medical school. They think that school is going to give them everything they need. It's only going to give you a small bit, just like our parents can only give us a small bit. And after that, you're going to need to do more, because everyone who's applying for that job that you want has the same thing: a degree, patient experience, and maybe some community service hours and a great GPA. Like, everyone got that. So how are you going to stand out when you're trying to get a staffing job? You have to really think about that. And that's where your mentors and your coaches come in to help you stand out, to give you the language. You don't have to go Google your life away. So let's move into, so for our next takeaway for the audience, this is your reminder to prioritize your well-being and your career growth simultaneously. I asked that question about the goalposts in the beginning because as high achievers, we forget to pause. We want to get into nursing school, then we have to graduate. We got to pass boards. We got to get that job. We got to get the next job that pays better. Then it keeps going. Oh, I think I'm burnt out here. Let me go back and get another degree. Oh, let me get this other certification I heard is really quick. Oh, I hope they'll pay me more once I get this certification. But I never sit down at the table to ask them, will I get paid more when I get this certification?
We didn't even ask.
Before I invest 12 months, 24 months, pay thousands of dollars for someone to watch my kid while I'm in school, working night shift, day shift, 3 weekends here, 6 trips over there. Just sit down and ask. They'll tell you right now whether they're going to do it or not. This is not a profession of hope. I mean, we offer hope, but we also have concrete conversations, right? Because none of this stuff is really necessary. It just looks really good.
Yes.
Right. And there was a time where there was just like an apprenticeship. People just, that's kind of what we do anyway. You go to school, you take all those tests, but you don't really, you don't feel like you learned anything till you show up and then someone's teaching you. So that part of the art and science of our practice is still very real. Someone's growing a business, small business, and they need help. Sometimes they'll be willing to take someone from who's fresh and grow them and mature them into what they want them to be, because one, they relate, and two, it's a little bit cheaper to bring you on than to bring on someone who has 10 years of experience. Let's just be real. So, that imposter syndrome creeps in. You think you don't have anything to offer, but you do. You're a warm body, you're a sponge, and you're willing.
Yes.
Right. Sometimes it just comes down to that. So make sure you prioritize your well-being and your career growth simultaneously. Set goals, remain flexible, advocate for yourself, just like you advocate for your patients, and embrace opportunities to pivot or innovate. Doing so ensures that you're going to have long-term success in this industry, which is, I love the industry, right? But I think there's a art to it,
Yes.
right? And you can get fulfillment, which I think we both have been able to experience.
Yes.
So let's bring this full circle. Remember the story we opened up with about patients waiting hours for care due to the staffing shortages. Now you understand the solutions in play: matching experienced nurses with the right roles, promoting healthcare education early and often with breaks, and supporting career growth to strengthen our community. And so what we've covered today is that excellence in staffing matters. Career flexibility and growth are important, and advocacy and self-care are simply non-negotiable. So before we sign off, let us know, how can our community connect with you?
If you smoke and you want to quit, first we want you to know that quitting nicotine is one of the hardest things a person can do. Not because you lack willpower, because nicotine physically rewires the brain. This is not a character issue, this is a chemistry issue, and you do not have to do it alone. Here are your options: nicotine replacement therapy, patches, gum, lozenges, and inhalers reduces withdrawal symptoms by giving your body a lower, controlled dose of nicotine while you break the habit. They are available over the counter. Chantix is a prescription medication that reduces cravings and makes smoking less satisfying. It is one of the most effective cessation medications available. Bupropion is another prescription option that reduces cravings and is especially helpful for people who also experience depression. Counseling and behavioral support, whether in person, by phone, or through an app, significantly improve quit success rates when combined with medication. Call 1-800-QUIT NOW for free telephone counseling. Visit smokefree.gov for free apps and text support. And talk to your care team about which option is right for you. Quitting is possible, support is available, and you deserve both. This message is brought to you by the Melanin Initiative Podcast, where we simplify health information so you can advocate for yourself and for the people you love. Find us on Apple and Spotify.
You can connect with us on any social media platform, #LoveNursingStaff, or you can reach us at www.lovenursingstaff.com. We thank you, Dr. Kimberly, so much. I want to take the opportunity not only to say thank you, but thank you for creating a platform for nurses. Thank you for creating opportunities for nurses and healthcare providers in general. Myself and all of Love Nursing Allied Staffing is truly grateful to you for that.
That's so kind of you. Thank you so much. And yeah, we have, shout out how we met. We met at the Black Health Connect conference.
Yes.
Every year they do like a free community health event. This was 24 in
Yes.
DC in 8th Ward, right? And yeah, I learned about you and your business, and you spewed off all these statistics and numbers, and it was just a beautiful business concept. It's one of those boring businesses that make 8-figure, 9-figure, revenue.
Yes.
Right? Because there's really literally no business, no company that can stay in business without staff.
None.
It really doesn't. And same with cleaning. I love the cleaning industry too. Again, you cannot keep any doors open unless your place is clean. But how many kids are told to start those kind of businesses or get into those kind of industries? Right? Same with plumbing and electricity. I literally don't know. The only thing I can do is change the light bulb. Anything else is wrong. I need help. And they're one of the easiest businesses to start because people already understand the value. You don't have to really convince them that they need to keep their lights on or their water running. And so before we sign out, because I think your business model is really exceptional, what are like 3 nuggets for that person who's thinking, I might get into staffing too? What are 3 nuggets you can share with them that you've learned, both that helped you, that you wish you would have done differently, and that you would give them based on your perspective of the future?
Awesome question. First nugget I would give is a nugget that was given to me by a mentor, Brian Nagel. I appreciate him so much. But people like to do business with people that they know, like, and trust, so that character, the character goes a long way. Know that, even if, you're still working on the capital and the revenue and the clientele, please know that character goes a long way. That would be nugget 1. Nugget 2 would be consistency is key. Consistency is key. You lay a brick at a time, and one day you'll have a wall. Don't worry about, the final outcome of the wall. Just lay a brick every day. And ultimately what it is that you work so hard to build will come into full fruition. Got to trust the process, moving forward. And a nugget that I would give about that is learn to trust the process, take off the hats. This is not, as you're growing business and entrepreneurship, it's unrealistic to wear every hat, even though we do it in nursing. Nurses in business, we have to learn to take the hats off. Absolutely, the multiple hats off.
One thing you would do differently?
One thing I would do differently is I would have taken multiple hats off sooner. Yes. And
do you see, how is AI kind of making its way into the staffing industry?
That it's funny that you asked that, because AI has never not been in the staffing industry. Like if you think about a job search platform, Indeed, Glassdoor, that's a level of AI, that's being utilized. If you think about keyword and triggers, within AI or within technology, keywords or I'm not the technical person, but if you think about those things, it's always kind of been a auto response to a degree. AI in healthcare, I mean, there's just placing any kind of but just placing a warm body can be problematic, right? So we want to place AI is great, where we are innovating and where we are bringing new technology to have better patient outcomes or do different research that is, or different experiments. That is amazing. AI is amazing within that point. But the one thing that I fear about AI in healthcare is that we can get away from the personal touch of what healthcare requires.
And your advice for someone who's listening to that and building an AI staffing company?
Don't forget the personal touch. Be mindful to just think whatever you're doing from a AI perspective in healthcare. Just think about if you were the patient on the other end. Like one thing that I have to give some reverence to here is like the things that we do from a telehealth perspective now, and some of the things that can be done, how a patient can go on and kind of say some of their key symptoms, and the AI generated computer will kind of do a triage and then connect you with the nurse based off of those symptoms. So that is great. But utilize it to advance the personal touch is what I would say, because at the end of the day, when we're not feeling well or we're sick, we want to be connected, so as long as your patient population has a way to feel connected, even within the AI space. And I know that there's a way to do it. It's just that this nurse is not the tech savvy person, which is why I have, our intern Chloe Ortiz, who is more AI and technology generated. But it comes from her generation as well. Chloe is a young lady coming up. She's 17, working as a CNA intern, and she goes and she puts together some amazing clippets and puts together some amazing brochures. A lot of this stuff that she does through AI that she's working on, and she presents it, in a way to us that we are still learning. So I'll say from an AI perspective, we are still learning. Be willing to learn. Be willing to learn more about AI.
And that person who is building, maybe they'll invite the two of you to dinner and pick your brain.
Yes, we're here for it, Dr. Kimberly. Absolutely, absolutely. Because again, one of the things that I love about the evolvement of healthcare and just the evolvement of people in general, and what we've even been able to do by adding an intern program, is when it comes down to the current space that we're in as far as the AI and the technology, something that I may not be as strong in, this intern, because this is where she's lived, and like some things that she does, she's been doing just because this is what they've done in school, for their entire lives. They've never not done it, in school. And so some of the things that the younger generation just presents from a technology standpoint always blows my mind, which is why I'm so grateful for Miss Chloe. Oh my gosh, she's amazing.
Yeah, thank you for bringing attention to her, because you did a couple things. You gave you elevated age, right?
Yes.
You gave her really authority. The CNA, again, you took them out of the patient care role and showed how much value they're bringing to that business. And you showed the importance of being a leader, which is not being afraid to hire people who are smarter than you.
Absolutely.
There will be new innovations all the time. You cannot stop and learn them all. You just have to hire people who have dedicated their time to that.
Yes.
Right. And that stops us from entering business, because I think I need to learn everything first. There's always going to be something to learn.
Absolutely.
Like when your business is in a garage, it's easy to keep track of everything. But once you're in a 10-story building, you're not going to know what's going on.
Correct.
You got to have the people in place that you can trust.
Yes.
So thank you for that. And I don't want you to discount what you know, because what you know is data. That's literally the internet.
Yes.
And that's what we're paying for these days.
Yes.
So LS, Love, Nurse, and Allied Staffing, thank you so much for coming on the Melanin Initiative. You're officially family now. You're always welcome back to showcase another initiative or talk more about the industry. You have our email, please use it. And for all the rest of you, you can also email us. We'll have their contact information in the description box, so you can contact them directly and invite them to dinner. But for us, you can email us any questions you have at tmi.melanin@gmail.com. If you haven't yet, you still have time to subscribe, give a thumbs up, leave a comment, share this with your friends, give us a 5-star rating on the Apple and Spotify podcast. Because every time you interact with our platform like that, it shows the algorithm that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. At the time of this recording, we're going to a new day and time, Saturdays at 8 a.m. Eastern on YouTube, LinkedIn, and we're still dropping the audio at 5 a.m. so that all our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.
Thank you.